within the product. Amazing Charts has been listed as one of the top rated EHRs on the market. Year after year, we are labeled as the easiest to use. And as far as affordability, you'll see our pricing here. Our pricing is very transparent. Our pricing model is based on providers in the office. We charge $1,200 for a software license. That's a one-time purchase. And it's $1,195 annually for support, maintenance, e-prescribing, and any upgrades. And recently we just celebrated our 15th anniversary since Amazing Charts hit the marketplace. Great. Hopefully that made the screen a little bit better. And also for all of you that are in attendance today, we are recording this webinar. We will be emailing you within the next few days with a copy of the recording and also with a contact point, assuming that you may have some specific questions that you'd like to speak with one of our representatives one-on-one to address. So the basic goals of this webinar are going to be to help you understand the requirements of the new CMS quality payment programs and also how to use Amazing Charts to help you succeed at doing this efficiently. There will be the ability to type in questions on the bottom right-hand corner of your controls. So if you do have any questions during this webinar, feel free to type them in there. If we can get to all the questions, we will gladly answer them during this. I realize that we're tight on time with quite a bit to cover and only having an hour slot. If we do not get to any of your questions directly during this webinar, as I mentioned, we will be reaching out to you and make it available to have a one-on-one discussion to go over any questions you might have and to do a deeper dive into Amazing Charts. We can show you a full product demo and how it can be an efficient product for you to take on within your office. Okay, with that, I'm going to introduce Christine Tremblay, and she is going to take over and drive you guys through the MACRA and MIPS pieces.
Good afternoon, and thanks for joining us. I'm Christine Tremblay, Director of Product Strategy here at Amazing Charts. We've been working hard on understanding all of the new requirements that are coming at you under the new MACRA and MIPS program. So we'll just start with a quick overview of the program itself, and then we'll dive a little deeper into all the tools that Amazing Charts includes with your license purchase that will help you achieve success easily under the MIPS program. So let's get started with some of these requirements. The Medicare Access and CHIP Reauthorization Act of 2015 is what's referred to as MACRA. And under that, they have created what's now called the Quality Payment Program, or the QPP. The Act is aimed at changing the way clinicians are reimbursed for services and shifting the fee-for-service model to reimbursing providers based on patient outcomes. Clinicians going forward under the MACRA program and QPP will be paid in one of two ways, either through the MIPS program, which we'll dive into today, or via alternative payment models, also referred to as ACOs and other programs that are approved by the government where providers put some of their revenue at risk in assuming that their quality scores will allow them to earn bonuses. We're just going to focus on MIPS today, so let's dive in. MIPS is the Merit-Based Incentive Payment System, and it consolidates programs you've probably been participating in the past, like the Physician Quality Reporting System, PQRS, Meaningful Use, and the Value-Based Modifier, which applied to larger practice groups. Each category under the new program, quality, advancing care information, and improvement activities, all contribute to a composite score that, when it's calculated, would determine who will get an incentive under the MIPS program and who might get a penalty. So let's review the timeline. We're now in March of 2017, and reporting for your 2016 programs for MU and PQRS should be complete or nearly complete at this point. You could start collecting data for 2017 MIPS participation starting in January and all the way up through October 1st of this year, as there is a 90-day minimum threshold of reporting for some of the categories. In 2018, you'll be upgrading to a new version of Amazing Charts that will be certified under the ONC for the value-based care programs. Amazing Charts has a currently certified product today that you can use for your 2017 reporting. You would need to upgrade to the new version sometime next year, before October 1st, as the rules state today. So next year, in terms of your payments, you'll be seeing your final adjustments under MU and PQRS based on your 2016 data that you're submitting now. And then early 2018, somewhere between January and March 31st, you'll report on your 2017 data. Here's just a snapshot of what the incentive or penalty looks like for calendar year 2019 and forward. So your 2017 data and the metrics that you submit will determine your payment level for 2019, either a plus or a minus adjustment. And that would be a maximum of 4%. In years following that, both the incentives and the penalties go up, as you can see. So what do you need to do this year? First, you're going to want to determine your eligibility. We'll show you how to do that. And we'll take you through your various options for reporting levels for 2017 and what the possible outcomes could be for those paths. We'll show you how you would select measures that are possible to report on from Amazing Charts, and then ultimately you'll have to report all of the statistics in early 2018. So who's eligible? You'd want to ask some questions here. Are you in your first year of Medicare Part B participation? Do you have Medicare Part B charges that are less than or equal to $30,000? By the way, that would be based on your 2016 activity. And do you provide care for 100 or fewer Medicare patients during the year? If you answer yes to any of these questions, you will not be eligible under the MIPS program. And your reimbursement rates would stay exactly as they are today, and you would not have to report on this program. But let's assume you're not in that category and you are eligible. Here's how the composite scoring is going to work under the MIPS program. For the first year, there'll be three components. The largest component will be the quality category, which comprises 60% of your composite score. Practice improvement activities, which comprise 15% of your score. And advancing care information, or your use of technology and interoperability tools, which comprise 25% of the score. So that in mind, let's look at what options you have for participating in 2017. Late last year, CMS issued guidance around how to pick your path for 2017. Their goal is to have as many people as possible participate in the first year of the program, so they've really lowered the bar on how much you would have to do just to get a passing grade. If you decide to do nothing, and you are eligible and should be submitting, you won't submit anything in early 2018, but you will automatically see a deduction of 4% from your payments in 2019. Certainly, the easiest and most expeditious path to participation in MIPS in 2017 would be the test path. But notice that you would receive no negative adjustment, nor any positive adjustment, likely no positive adjustment. And you're really only required to report on one quality measure or one improvement activity or the 4 base advancing care information measures. If you wanted to do more, like partial or full participation, you would choose between 2 and 6 quality measures, or 1 measure set, between 2 and 4 improvement activities, and the 4 base measures for advancing care information along with some of the performance measures. We'll go a little deeper into what each of these things are a little bit further on in the webinar. The minimum time frame for participation would be 90 days, although you can report data for up to a full year. Partial and full are really identical in terms of the requirements. The difference is just about the amount of effort you want to put in and the amount of data you want to collect and report. The more measures and activities you report on and the longer you report for increases your chances of an increased Medicare payment. And we'll dive a little deeper into what a positive increase in your Medicare payment may look like so that you'll be making an informed decision. So next, let's look at advancing care information. This piece is worth 25% of the overall composite score, and it's really about how you use the technology you've adopted in your practice. Amazing Charts already has all of the tools you need to complete the required base measures quite easily. And if you decide to embark on performance score and bonus points, we've got tools in the box for that too. You can report, or you must report, for any 90-day period on these base and performance measures, but again, up to a year if you want to earn bonus points. So let's take a look at how Amazing Charts can give you the tools, in particular for this advancing care information category. So the 4 base measures, as we mentioned, need to be monitored for 90 days. But you only need to meet a numerator of 1 in order for you to be successful. For example, the base measure for providing patient access would only need a numerator of 1. Amazing Charts includes a patient portal to help facilitate patient access to your practice and automatically allows you to publish the most up-to-date version of the summary record for your patient's retrieval. For health information exchange, you also need at least one patient and at least one transition of care to another provider from your practice. For this measure, we provide tools like direct messaging, a CCDA, and easy-to-use communications tools for patients. For e-prescribing, perhaps the easiest one, you also only need a numerator of 1, and you only need to record 1 prescription per eligible clinician for which you've queried a drug formulary and have sent to a pharmacy electronically. E-prescribing is a core part of Amazing Charts, and that measure should be very easy to meet. The one base measure that we can't necessarily do for you within the EHR is your security risk analysis. But we've got partners and tools that can help you conduct this analysis and refresh it annually as is required. We also talked about performance points or performance measures under the advancing care information category. You can earn up to 10 bonus points, as you see, but after you've made the most up-to-date version of a clinical summary available to patients online, they can come and download or transmit that record to whomever they choose. You can earn extra bonus points if your patients are utilizing your portal. We'll show you a little later how easy it is to distribute education to your patients about their problems, new medications, and lab results. Those are really easy to track within Amazing Charts, and you should be able to earn bonus points up to 10 points by utilizing those tools that we include. We'll also show you how easy it is to manage medication reconciliation when patients are transferred into your office, and this is another opportunity to earn bonus points. Here is the medication reconciliation screen. It allows you to check off right in this window when a patient has been transferred into your practice. During that intake visit, you're probably going to discuss the active medications and record them in the EHR. Once you've indicated that medication reconciliation is complete, you would get bonus points for this measure. I mentioned we have patient education throughout the product. You're able to easily access this from the patient's problem list, from the medications workflow, and within our lab results. You can easily see that if you are clicking on a medication name, you can click the Retrieve Patient Education button. Once you do that, you'll see a printed version, a printable version of the patient education that you've requested, and you'd have the opportunity to send that to the patient via the portal, via a message, or print it right in the office as they're checking out. Let's take a look next at improvement activities. These are 15% of the pie. And they probably are areas that your practice is focused on already. Improvement activities will be an attestation. What that means is you will attest or certify to the government that you are doing these things within your practice. Some examples are listed here. Quality measures, the 60% or the largest slice of the pie, is something that Amazing Charts is focused on over time and allow you, either as a family practitioner or as a specialist, to track individual metrics or measure sets. And you can see from this list that we'll make the most up-to-date versions of these available for your use. Outcome measures are also required under the rule and are easy to manage using our clinical decision support tools as well as wellness reminders and screenings. High priority measures can earn you bonus points in this category as well. I mentioned that we include patient management tools. This is a screen that shows you how easy it would be to run a report for everyone in your practice that is due for a breast cancer screening. You can turn this list into an action list for your support staff, and they can email, call patients to get them in for these screenings. We also build in tools to make it easy to be interoperable with other practices. You can manage referrals and transfers of care. We include direct messaging accounts with all of the Amazing Charts licenses. And you can package up the relevant details, customized letters, lab results, any kind of information you want to include when referring to another physician, like a specialist. Messaging is available from virtually any screen. How will you know if you're being successful? Well, we provide tools that help you track your progress. This is a picture of our current Meaningful Use Wizard that easily displays how you're doing for the measures that you're interested in tracking. On the right-hand side, you can see passing and failing grades specific to MU. As I mentioned, under the MIPS program, for the most part, you'll only need to show that you've got a numerator of one patient that has you've completed the activity successfully for. So let's go into your options again. If you just want to avoid a penalty in 2019, the test path that we talked about, you just have to do the bare minimum. You won't earn a positive adjustment, but you will avoid a penalty. And your choices are easy. One quality measure for any time period, one improvement activity tracked for 90 days, or the easy-to-meet 4 base measures for advancing care information. If you want to do more and increase your chances of a positive adjustment in 2019, we have the tools for you here too. You would pick between 2 and 6 quality measures or 1 measure set, between 1 and 4 improvement activities for at least 90 days, and advancing care information, the 4 base measures, and any performance measure for at least 90 days. Again, the more you do, the more you may get. How much you earn is going to depend on 2 things. The number of points you get in all 3 categories, along with how well others do in the market. Very important point. The MIPS program is a budget-neutral program. This means that the total amount of extra money or incentives earned by clinicians must equal the amount of money taken away from other clinicians. So for quality in particular, national benchmarks will be used to determine whether your practice is doing better or worse than your peers. Our advice on quality is to do the things you think you can excel at and do them really well. We don't know today how points translate to dollars, but early estimates show that even if you're doing the maximum, you may qualify for a modest adjustment, around 0.5% positive adjustment to the reimbursements that you see today. Earning a composite score over 70 is considered exceptional, and exceptional performers could earn more. Here's just a quick graph produced by MGMA that shows where most providers are going to fall on the threshold and show pretty clearly that the adjustment for the 2017 reporting period will likely be modest. Want to know more? Please visit amazingcharts.com. We have a fabulous section on the website filled with MACRA and MIPS resources, including frequently asked questions, links to industry resources like the CMS website, and a website they've created specifically for the quality payment programs called the QPP. We've included helpful publications and some checklists to help you prepare and do the best you can in 2017. There's a link here on this slide to the QPP website as well. I can attest that we use the QPP website quite regularly, and if you have questions about anything that's on that site, you can log your question online, and someone from CMS will reply to you directly. All right, I'm going to turn this back over to Adam to help us wrap up.
Thanks, everybody, and thanks, Christine, for taking us through that. And again, just to reiterate what I had said at the beginning, Amazing Charts has pretty much made a name for itself in the marketplace by being easy to use in comparison to other software products. And I understand this MACRA and MIPS piece is probably intimidating and confusing to many of you. We've gotten out in front of it to try and make sure that we continue to deliver that ease of use and a proper educational platform to provide our clients with the tools that they will need to move forward in this ever-changing marketplace. Should you guys have any direct questions, feel free to reach out to me directly. My email is alombardi, L-O-M-B-A-R-D-I, @amazingcharts.com. You can also contact sales @amazingcharts.com, and one of my dedicated reps would reach back to you and set up a one-on-one consultation as well as a product demo if you are interested in looking at our electronic health record platform. I'm going to take a quick minute and just look through and see if we have a few questions, and I'll pass it back to Christine to get you some answers.
Thanks, Adam. We did have some great questions come in, and we'll read these out to you now. Regarding eligibility, is the $30,000 based on Medicare allowed amounts or charges billed? That's a great question. CMS is looking at the assessment period that starts September 1st, 2015 through August 31st, 2016. And if you have charges that fall below $30,000 allowable charges, or below 100 patients seen during that period, they plan to send you a letter by the end of March 2017 that you'll be exempt for the 2017 reporting period. So it's important to note that you will not have to inform them. They will be informing you, and it will be based on the data that, or the claims that you've submitted and the number of patients you submitted for between September 1st, 2015 through August 31st of 2016. Great question. Here's another. Regarding MIPS and MACRA, are there exclusions for participation in place for rural practices? The majority of patients in rural areas do not have access to computers or smartphones in conjunction with reliable internet access. Also, literacy is low in this area, so the chance of patients using a patient portal is quite low. Okay, the answers here are that there aren't any measure exclusions for rural practices. However, given that there's a test path for MIPS, and you only need to have one in the numerator for the 4 base measures, literally 1 clinical summary sent, 1 transfer of care sent, 1 electronic prescription, and the security risk analysis, this will allow you to avoid a negative payment adjustment. For partial and full participation, you need to get more points. And the higher the percentage you earn for multiple measures. So there's no threshold that you need to meet for any measure. For example, if you get 11% on your patient access, it will still earn you 2 points, whereas getting 33% for the same measure would earn you 4 points. So this should make it possible for smaller, more rural practices to earn at least some points or at least avoid the adjustment. Another great question. Just get the full text. We are an endocrine practice. What quality measures should we be looking at? Great question, and another reason to go to the QPP website that I referenced earlier. You can filter all the available quality measures down to a list that is just relevant to you, and it does allow you to filter by specialty. So great place to look for those measures and a measure set that would apply best to your practice. You can go outside of those and do others, but that would be our recommendation. And a question about the partners that we use for security analysis and the risk assessment. We currently use a company called Emerald Cybersecurity. They're a partner that we've used extensively during meaningful use, and our practices have had success with. You can find their contact information on our website under the Partners tab.
Thanks, Christine. And then a couple questions that I see here specifically about the EHR and product pricing, et cetera. Somebody typed in that they are a single provider practice with a few other employees. They wanted to know if those costs were per employee that I mentioned or if it was just going to be for the provider. Our pricing is based on providers. So if you guys have nursing staff, front desk people, anyone like that, they're not required to have a software license or pay any support costs. What we consider to be a provider is somebody that's going to be making medical decisions, writing prescriptions, and or assessing patients, assigning diagnoses, and signing off on medical charts. If you don't fall into any of those categories, then you would not be required to have a license. So a nurse could help get people in the room, check them in, go through vitals, things like that. They will not need a license or support. Only the doctor or provider that's actually signing off on the chart and making the final assessment is going to be required to have a software license. A second question came in asking about switching and how are we managing to transfer data from one EHR to another. This is all included in the move. Depending on the EHR that you're coming from, anybody that was certified during MU2 had to be able to create a CCDA export, and we are able to import that data. We would have to have it converted either into an Excel or a CSV format, which is very simple, and our techs would be able to assist you with that. So you'd start off with most of the information aside from some of your handwritten notes or typed notes in your system, but as far as medications, problem list, allergies, demographics, most of that information we'll be able to start off in Amazing Charts for you, and there's no additional charge for that. If you're able to provide us with that file, our staff will gladly move that information into Amazing Charts for you. Amazing Charts also offers a 28-day free trial. You can see that at the bottom of this page. And with the free trial, you actually get the full software. The only thing that you're not going to get during the trial is the ability to e-prescribe. That's turned on with the support plan. But everything else that's included in Amazing Charts would be accessible in your trial. So the reason that we've maintained these #1 ratings is we realize that there's different cleats for different sports. We want to make sure that Amazing Charts is the right fit for our clients. We want somebody to make an educated decision and not just buy it based on one phone call. We'd rather have them drive it, use it, actually maybe even use it in your office so you can compare what the time length is in documenting an encounter in your current product versus documenting that same encounter in ours. That way you can make a decision based on your own experiences and not just what you're hearing from me. And then some people had asked some questions about would they be able to reach out and get more information from us regarding the MACRA and MIPS. And yes, that anything that you might think of after this, of course, while you're sitting in front of the screen, some of the questions might not come to mind. And as soon as the webinar ends, I'm sure 15 or 20 of you are going to say, oh man, I wish I asked this question. Don't worry about that. Like I said, we'll be emailing a copy of this, but prior to us even reaching out to you, feel free to reach out to me directly or my team, and any of us would be glad to assist you with any of your needs or in answering questions. If some of the questions are beyond my scope, I'll loop Christine back in and we can get you some solidified answers. Let me take one quick look and see if we have any more, and then one last question regarding Amazing Charts. Somebody asked, will I need a server to use Amazing Charts, or are you strictly cloud-based? Amazing Charts would offer either solution based on a practice's need. We probably are about 85% local install because cloud services are something newer in today's marketplace. We've had clients that have been on Amazing Charts for 15 years before anybody had really moved to the cloud. Now, as more people are looking for those cloud solutions, obviously more of our sales recently are coming in as cloud-based services. So it would be up to you, whichever way is going to be best for you. If you are going to go with a hosted or a cloud model, obviously a few things come into play that will have basically an effect on your experience, one of which will be your internet service. So if you do go with a cloud-based model, you want to make sure that you have good internet connection and quick upload and download time. Otherwise, you might notice a lag compared to if you operated it from your own local server. And we got one more for Christine.
Thanks, Adam. We got an inquiry about from someone who's part of an ACO and questioning whether or not they are still subject under MACRA-MIPS. Well, MACRA is inclusive of ACOs. ACOs eventually are all supposed to be included under the alternate payment model reimbursement rather than MIPS. However, you should check with your ACO specifically. They would have had to have submitted an application to CMS to see if your ACO would qualify today as an alternate payment model. And the assessment is based on the financial risk that the ACO is taking on and current quality scores coming out of that individual ACO. So check with your ACO to see if they're qualifying as an APM for 2017. If they're not, you can still use the Amazing Charts product to conduct all of your patient care and all of your interoperability activities. And we have the ability to integrate with other clinical quality measurement systems. So many ACOs will have a way to track your clinical data so that it can all be aggregated together for the ACO as a group. We're happy to work with whatever software solution that your ACO is using for quality statistics and make sure that we can send them the data at your request. So whether you're doing MIPS and creating quality statistics directly from the EHR, or whether you need to submit them to an ACO to be included as a group, we can support either of those models.
Thanks, Christine. I just had one more question spurred from my discussion about cloud services. Somebody asked if it's difficult and a long process to move to the cloud, and the answer is no. It's seamless, depending on where you want us to put the installation. If you're already a client of ours and you're on a local server, moving to the cloud could be as little as 24 to 48 hours, and everything happens behind the scenes with little involvement from the practice. If you're looking at joining Amazing Charts and starting fresh, it's just a matter of where do we actually install the product. Do we install it in your office or on the cloud server, and you'd be up and running. So it is seamless. Another question popped up about, are the costs comparable? There is a fee for hosting the product, and that's based on the number of users that need connections. Depending on the term that you agree to, those prices could range anywhere from $30 to $39 a month per connection that we set up. So if you have a 4-employee practice and all 4 people are going to need to log in at the same time simultaneously, you would need 4 connections in that office, but only 1 license in the case that we discussed earlier, where it's a single provider practice with a total of 4 employees. If some of those people have split shifts, they could actually just share a connection. So let's say Mary works Monday, Wednesday, and Friday, and John works Tuesday and Thursday. They could both use the same connection because they're not going to be there and stepping on each other's feet. They'd be able to log in, and it'd be able to reduce 1 connection that you guys are paying for at your end. And in the event that any of you do want to check out what the cloud services are like, we do offer a sandbox trial where you can have access to what Amazing Charts is like on the cloud, and you'd have access for 24 hours to play around with it, and then the password would expire. If anyone wants to arrange that, feel free to reach out to me directly, and I'll have one of my staff members set you up with that trial. That would take only a couple hours in response time. Another question specifically about the EHR, do we only offer electronic health record system, or is there an accounts receivable and billing side? Yes, there is. We do offer a fully integrated practice management software as well as the clinical side. So for those of you that are looking to take the billing in-house rather than pay a third party to handle the billing for you, we can facilitate that for you as well. The practice management is obviously an additional module, so there are additional costs to it. Again, we model our costs based on being the lowest price that we can find in the marketplace. So where we've landed on the practice management is it'd be $249 a month for the first provider. It'd be $198 if you had a second provider to add, and then each provider above 2 would only be $99. So if you had 3 providers, it would be $249 plus $198 plus $99. If you went up to 10 providers, you would be $249 plus $198 and then $99 times 8 for the remaining 8 providers. We've modeled it based on the lowest comparable products out there charge around $299 per provider. So we've made it a point to stay easy to use, but also to stay affordable. We're dealing with mostly smaller practices with 1 to 10 providers, and we want to make this something that's easy for all of you guys to take on rather than being a burden either on your wallet or on your time spent documenting. Okay, with that, it looks like we've pretty much covered all of the questions that have come in. So I want to thank everybody for joining. Thank Christine for going through the heavy lifting portions of today's webinar. And I look forward to speaking with any of you guys that may have some specific questions about our software or again about the MACRA-MIPS and upcoming changes to expect. So thanks a lot everybody for joining, and hopefully I'll be speaking with you soon.